Very good evening, friends. Meeting again after a big gap with the Matramedica session. And today we're going to learn one more important remedy from the fourth year syllabus, and that is the nosewood, the Anthracinum. It is an anthrax poison. This remedy was very early proved by one of the veterinary doctor Lux, and he explained that remedy specifically for the on the animals showing the splenic fever, and in case of human beings for the recurrent abscesses or boils. This nosode has made very wonderful cures in my practice. I will share certain specific cases which have which are completely recovered after giving the anthracinum. One case I recollect, it was when I was working with my sir, Dr. Nitin Bhagli, and there one patient was admitted for the actually for the lumbar disc prolapse. He was operated, and thereafter, before that, just now, before operation, during routine checkup, he found to be a diabetic. He was maintained on insulin and then operated. But after post-op, on the fourth day, he had a very severe abscess in the sacral region. Very big abscess, perineal region, not perineal, that is the sacral area. It was a big abscess. Sir has drained that abscess, but it was nearly of this fish size. It was so severe, and it was not getting recovered. And during that specific time, I was not there for 8 days in the hospital. And sir called me, Prasad, do come early. There is a big, very important VIP patient is there, and this is the problem. And there should be someone who look after things. So do come. So immediately I went over there, and then I saw this patient who was having a very big abscess over there, and I asked, sir, shall I give him homeopathy? He said, why not? It's needed because otherwise there are very less chances that he will recover. So I worked out his case. He was diabetic, just found to be diabetic, but actually he might have a long-term diabetes, but he, as being a person who was frivolous enough, he has not looked towards it, and that's why. That was one thing. Second important thing, that it was very offensive discharge which was coming, and there was a lot of oozing, bleeding, bloody discharge was there, and that is of a typical character of a black color. So it was coming out or dark offensive discharge. I have given him a anthracinum, 3 doses, followed by Silicia 6x continued. And I have done the calendula dressing. Whole abscess I have cleaned with the regular antiseptics, and then I have put the whole gauze soaked in calendula mother tincture. I have put over there. And to the surprise, it was healing so fast immediately after starting the medicine. Within span of 8 days, the whole pit which has been developed over there recovered completely with the help. The granulation was very fast thereafter. And it was first time I have used anthracinum when I was learning. I was there in fourth year at that time. And thereafter, in my practice, many times I have used this anthracinum to stop the tendency to abscess. Even though we have selected very perfect simile moment, it is not working, and abscess is getting recurred again and again. I used to use anthracinum as a intercurrent remedy or to stop that, and it definitely works. Recurrent boils, recurrent abscesses, recurrent carbuncles, phalons, then panaritium. This remedy is the wonderful remedy, and to stop the recurrence, Anthracinum always helps. Then I have used it in the tendencies where generally it looks like a viral rash getting secondary bacterial infection. Anthracinum as an intercurrent works over there and stops that tendency. So this is one more, at one more level, I have used this Anthracinum. So this is a wonderful nozzle one has to learn by heart. Uh, Allen has given physical aspect, even Boric has given physical aspect, but when I read this remedy from the Vitulkas, he has explained the mental aspect, psychological aspect of this remedy. And he has used one important word over there. It is there is an emotional abscess over there. The emotions, because of some grief, it gets saturated over there and remains, and person goes into the indifferent state. Sometimes it looks like a sepia like state over there, or natrum like state over there, and along with some outlet in the form of physical sphere, in the form of abscess, in the form of phelons, in the form of carbuncles. And this emotional aspect, if you catch, then you must think about the Anthracinum. That's what George Vitulkas has said in his Materia Medica Viva. So, a few aspects of mental, psychological, or emotional level mentioned by Vitulkas in the Vivas. My suggestion is to go through it and read that. Now we'll start with the Allen's Keynotes. In carbuncle, malignant ulcer and complaints with ulcerations, sloughing, and intolerable burning. Burning is the characteristic over there. Intolerable burning. Sloughing, the discharge, very offensive necrosed discharge, which is there in the abscesses. When arsenicum or the best selected remedy fails to relieve the burning pain of carbuncle or malignant ulceration, you must think about the anthracene. So, well selected remedies whenever works or cures, the anthracinum is the best solution. Hemorrhages, blood oozes from the mouth, nose, anus, or sexual organs. Black blood quality is very important. It is black, thick, tar-like, rapidly decomposing, like croton tea. Many times this neck remedies comes closer because here the discharge is very similar to it. The septic fever looks like pyrogen. Septic fever, rapid loss of strength, sinking pulse, delirium, and fainting. It goes close to the pyrogen, but pyrogen has very specific tendency that pulse rate is out of proportion to the fever. Gangrenous ulcers, phelons, carbuncles, erysipelas of malignant type. This remedy goes into psychosyphilitic miasm or the cancer miasm. You get all those pathologies, specifically on skin, you get much more pathologies. Phelon, it is nothing but the abscess around the nail bed or near the nail. There are carbuncles, which is commonly an indication in the diabetes. Erysipelatous condition is it is the cellulitis generally happens on the skin. Malignant time, this word malignant is not easily healing, not easily getting recovered. Phelons, the worst cases with sloughing and terrible burning pain like arsenic, like carbolic acid, like lachesis. Malignant pustules, blue or black blisters, often fatal in 24 or 48 hours. So this is rapidly increasing abscess, phelons, which carbuncles are there and which leads towards the death very fast. Specifically, if diabetes is associated, this chance is much more. Those are always fatal. Lachesis, then pyrogen, these are remedies which are mentioned. Carbuncle with horrible burning pains, discharge of Ichorus offensivus, dissecting wounds, especially if the tendency is to become a gangrenous, septic fever, and marked prostration like arsenic pyrogen. So, arsenic and pyrogen, these two remedies are very close to this anthracinum. But when arsenic and pyrogen fails, one must think about the anthracinum. Suspicious insectings. If the swelling changes color and red streaks from the wound map out the course of lymphatics, this remedy is a wonderful remedy. So if there is insecting or something like that, and if there are red streaks of the arms showing the lymphatics over there, this remedy is a wonderful remedy like lachesis and pyrogen. Septic inflammations from absorption of pus or other deleterious substances with burning pain and great prostration like arsenic and pyrogen. Epidemic spleen diseases of cattle, horses and sheep. So this is again one of the important remedy for specifically in animals. This is from the Mr. Lux. This has been explained over there. Bad effects from inhaling foul odors of putrid fever and dissecting room, poisoning by foul breath, pyrogen. So gangrenes, sometimes it is gas gangrene, sometimes it is wet gangrene, sometimes there is dry gangrene, but the offensiveness is characteristic over there. Herring says, to call a carbuncle a surgical disease is greatest absurdity. An incision is always injurious and often fatal. The case has never been lost under the right kind of treatment, and it should always be treated by internal medicines only. So what Herring says is very right. Such types of carbuncles never require scalpel. Many times big abscesses I have opened with the homeopathic remedy. Anthracinum is one of the important remedy to heal them. At the same time, to open the abscess, my suggestion is always that give the hepasulf in 6 potency in repeated doses, followed by siliceous 660 days. It definitely opens up the abscess very easily. Relationship similar to arsenic, carbolic acid, lachesis, sickle, pyrogen in malignant and septic conditions. Compare euphorbium in terrible pains of cancer. This is also one remedy for severe pain, cancer pains. Pains of carbuncles and erysipelas when arsenic and anthracinum fails to relieve. This is one thing which has been mentioned by Allen. There are few clinical points one must not forget regarding this remedy. My suggestion is that skin conditions, specifically abscess, boils, acne, carbuncles, erysipelas, malignant pustules, phlegmonous inflammation and ulcerations, smallpox, ulcers and vitiligo. Others, there are parotitis gangrenosa, splenic fever, then there is epileptiform convulsions, insect bites with swollen gland. This remedy plays the very important role. Few relationships which are not mentioned over there in Allen's keynotes must add in your book. It is followed well by aurum muraticum, nitronatum and silicia. So this after this remedy you can give aurum muraticum, nitronatum or silicia. And this remedy follows well to the arsenic album and phosphoric acid. Generally, potency, you can use it right from 12C potency to the 201M also. And it is very specifically produces good results in 200. That's what I observed in my practice. So a very important remedy from the Allen's keynotes and fourth or syllabus we have finished. My suggestion that Aeschylus, it is already video is uploaded over there. So I have not, I will not going to repeat that. It is already uploaded. Yeah, I have added it in save playlist so that you can get it over there. So we can finish the remedies very early. So that's all for today. Tomorrow we'll definitely meet with some other remedy. Thank you and good night.
Hello, sir.
Yes.
Hello, sir. Sir, I have one patient, case of 48 years of age, female patient. She is suffering from asthma and nasal polyp. I take a case and I have given her, gave her a Kalibai 30. Actually, Kalibai 30 नंतर sir, asthma is much better after Kalibai 30. And when I prescribe her Kalibai 30, on 4th or 5th days, she got menses. Actually, her age is 48 and 4 months she has not menses. And she declared it may be menopause now. आणि कालीबाई दिल्यानंतर 6th डेला मेन्सेस तिचे आले आणि आता हा 4था महिना मेन्सेस रेग्युलर आहे तिचे तेव्हापासून कालीबाई मी 30 दिलं बरं कालीबाई 30 दिलं त्याच्यानंतर ब्रेथलेसनेस कमी आला पण ते नेझल पॉलिप जे होतं ना पण ते पॉलिप असं मास असं दिसत नव्हतं म्हणजे स्पुटम सारखंच ते दिसत होतं व्हाईट वगैरे असं आणि ऑब्स्ट्रक्शन वगैरे खूप होतं. मग ते काय तिला बेटर नव्हतं, म्हणजे बरं इतकंसं वाटत नव्हतं. म्हणून मग मी काय केलं, कालीबाईट 200 दिलं. मग तरी पण काहीच म्हणजे काहीच रिझल्ट नाहीये. मग मी काल आता तिला सगळं हे करून ट्युक्रीम मॅरम मॅरम दिले, का तर व्हाईट डिस्चार्ज सारखंच आहे ते राईट साईडला, आणि पूर्ण नोज ब्लॉक आहे, आणि व्हेन ब्लोईंग द नोज देर इज अ व्हाईट प्लग्स लाईक डिस्चार्ज इज देअर. पण कालीबाई नंतर एक झाले, पहिलं तिला फोरहेड मध्ये म्हणजे हेडेक भयंकर होतं, सायनोसायटिस होतं. कालीबाई नंतर मेन्सेस एक तर आले, आणि हे सगळं थांबलं. अस्थमा इज मच बेटर आफ्टर दॅट. पण ते जे आहे ना मास, ते काय कमी नाही येत आहे तिथं. मग 200 नंतर मग मी आता सरळ तिला ट्युक्रियम दिलं.
ठीक आहे, ट्युक्रियम मॅरम व्हॅरम इफ you'd have given, repeat it. It should
हा.
not be given in doses. It will not work. Teucrium arum verum bears the repetition. You must continue it at least for 8 to 15 days and then see what is the result of
Continuously.
30. 30 you can repeat 3 times a day
ओके ओके सर.
for
ओके.
15 days and let us see after 15 days. If it never works, then find it out patient's remedy. There are many
येस
more
सर.
remedies in for the nasal polyps, but you have to find it out exactly the modality and then you have to give. If Teucrium works, well and good. If it never works, then we'll define. Definitely.
काल मी तिला बीडी दिलं होतं, आज मी टीडीएस खायला सांगितलं, तर
ठीक आहे.
संध्याकाळी शी कॉल मी सेड की बरं वाटतंय मला आता, म्हणजे
Let us see.
ओके म्हणजे ठीक आहे
Give
मग.
it for 15 days.
हा. ओके ओके. थँक्यू सर.
Okay. So thank you and good night. We'll meet again tomorrow. Thank you.
Thank you, sir.
थँक्यू.
Good
गुड
night.
नाईट.
Good night.